to go through to learn this material for ethics, laws, boundaries, regs, et cetera, I think it's completely fine to learn it by doing questions. And that's one nice thing about it, is that we don't have to do like so much foundational material and then do questions on top of it, because we can learn the foundations through the questions. All right, so you guys just unmute and call out. All right. Can everybody see this? Is this large enough?
Yes.
Yeah. Okay, just call out if you can't see it. Say, I can't see it. What does the word abuse mean? A professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. To withdraw support, especially in spite of duty, allegiance, or responsibility. An obligation or willingness to accept responsibility to account for one's actions and consequences. What does the word abuse mean?
B.
All except A.
Yeah, say B.
Okay, so 2 A's, 2 B's, and 1 A. So let's reread it. So A is a professional relationship in which a more experienced practitioner shares information, skills, and insights with a less experienced practitioner to provide encouragement and support. Does that sound like abuse?
No.
That sounds like, I'd call that mentorship. The improper use, handling, or treatment, often to unfairly or improperly gain benefit. Yeah, definitely. Definitely B. B, the improper use, yes. Abuse is the improper use, handling, or treatment, often to unfairly or improperly gain benefit. Mentoring is the professional relationship in which a more experienced practitioner shares with a less experienced practitioner. Withdrawing support, especially in spite of duty or allegiance, is called abandonment. That's a legal term. Accountability is an obligation or a willingness to accept responsibility or to account for one's actions. An obligation or willingness to accept responsibility or account for one's actions and consequences. That's accountability.
There's more than one answer, correct?
There's only one answer. There's only one answer. Tell me why you think there's more than one answer.
Because I thought all of them except A might have been the answer.
You thought B, C, and D may also be the answer.
Mm-hmm.
Okay, so abuse means improper use, to use something that you're not supposed to use for benefit, right? To use something for your benefit, to gain benefit that you're not supposed to use for a benefit. So, like abuse can be sexual. That's what we usually think of, where you use your influence or power or maybe your physical position over someone else in order to gain sexual benefit. Abuse can be financial, where perhaps you abuse the billing system, the insurance billing system, in order to gain that kind of benefit. And there are, I'm sure, like other kinds of abuse, but those are the two that I think of right away.
Okay.
Improper use, handling of someone's health insurance, handling of someone's trust in you improperly to gain benefit, right? Handling of the treatment improperly to gain your own benefit. And then to withdraw support, to withhold support. Yeah, you can be abusive withdrawing or withholding support. But when you withdraw, that word withdraw, it's especially abandonment. So if you say to a client, I'm not going to treat you anymore in the state of New York, without providing them with a referral, the recommendation to go back to their primary care physician to find another therapist, or without referring them to at least 2 other acupuncturists, that is legal abandonment, because you are withdrawing support without providing a replacement for the support, making sure someone doesn't get support. And then an obligation or willingness to accept responsibility. That's asking you, Stephanie, I want you to accept responsibility for your actions or to account for your actions, whether they're positive or whether they're negative and have consequences. I want you to accept responsibility. That's your accountability. That's accountability.
Accountability.
Okay. A code of conduct that provides guidelines to those who post content on the internet, either as part of a business or as a private individual, either as part of a business or a private individual like solo practitioner. Code of conduct that provides guidelines to those who post content on the internet. Standards of practice, competency, code of ethics, or social media policy?
Social media policy.
Yes, a code of conduct that provides guidelines to those who post content on the internet. Social media policy. What is the meaning of the term scope of practice? In some states, it is used as the designation for practitioners rather than licensure, a process in which a person, an institution, or a program is evaluated and recognized as meeting certain predeterminable standards to provide safe and ethical care. Used as a designation for practitioners rather than licensure. Most commonly defined by state law, this outlines the care you are able to provide for a patient or client, the where, when, and how a practitioner may provide services or functions as a professional. Most commonly defined by state law outlines the care you're able to provide for the patient or client. A set of rules designed to address applicable state and federal laws, as well as established business practices and professional ethical standards. A set of rules designed to address applicable state and federal laws, as well as established business and professional ethical standards. A statement of intent that defines expectations and is implemented as a procedure or protocol. So what do you guys think?
B.
Letter B, that's right. It outlines the care you're able to provide. This next one, a set of rules designed to address applicable state and federal laws. That is a code of conduct, a code of conduct. They're going to ask you about, they may ask you about these others. A code of conduct, a set of rules designed to address applicable state and federal laws, code of conduct. Scope of practice is the care you are able to provide, the care you're licensed or certified to provide. What is within your scope, right? And then this one, designation for practitioners other than licensure is a certification. So a certified acupuncturist is a thing in New York. A licensed acupuncturist is a thing in New York. I don't know if you guys have certified massage therapists compared to licensed massage therapist. Probably is in some states. And then in Connecticut, yeah. And then policy is a statement of intent that defines expectations, what the client can expect, and what you expect. You expect your client to give 24 hours notice, to pay at the time of the visit, things like that, right? As a procedure or a protocol. Policy. The experience of, I guess we're just going to show the answer right away. The experience of reliving or re-experiencing a traumatic event as if it is occurring or is imminent is known as a trigger, complex post-traumatic stress disorder, flashback, or hyperarousal. The answer is flashback. Does a flashback happen before or after a trigger? No, which happens first, the flashback or the trigger?
The trigger.
That's right. Is the state that you're in, that person is in, a state of hyperarousal, or is it a state of post-traumatic stress disorder?
Post-traumatic stress.
The state is hyperarousal. The state is hyperarousal. Their nervous system is hyper alert, hyper aroused. The diagnosis is post-traumatic stress disorder or complex post-traumatic stress disorder. This is what they suffer from. This is how they function. Hyperarousal is how they function. Of the following, which is the best choice for a scope of practice? What is this question doing here in ethics, laws, boundaries, and regs? Anyway, of the following, which is the best choice for a scope of practice defined as a service provided to enhance the health, condition, and appearance of skin, hair, and nails? Skin, hair, and nails. Cosmetology, osteopathic medicine, naturopathy, pediatric medicine.
Cosmetology.
Cosmetology. Everybody agree?
Yes.
Yes, cosmetology. A blank, also referred to as a multiple relationship, occurs between a therapist and a client when additional relationship roles such as friend or business associate exist. What is this called? Professional relationship, dual relationship, homeostatic relationship, or a personal relationship?
Dual relationship.
Yes, that's right. Why is it a dual relationship, Victor? Vincent, I'm sorry.
It's because you're being a massage therapist and also a business associate or a friend.
Yes, that's right. You're being two things at the same time. Okay, Blank is a code of behavior that delineates expectations. Behaviors that fall under the heading of good manners include cancellation notification, being punctual, hygiene, and personal habits. Blank is a code of behavior that delineates expectations. We just learned about that. So is that competency, etiquette, work ethic, or social media policy? Oh, it's a different type, different phrase here.
B.
A.
It is
What-
B.
what the- Oh, it is. B. Okay.
Yes. And what tips you off is the second sentence, behaviors that fall under the heading of good manners. Rarely is anything wasted in these questions. If they give you two sentences, you got to read both sentences. There's something in the second sentence that's important. All right. Yeah. What is the meaning of the term clinical supervision? Is that a process of meeting regularly with a person who is trained in the skills of supervision to discuss casework and other professional issues in a structured way? Is it a protective circle around the professional relationship that separates what is appropriate between practitioner and client from what is not appropriate? Is it a group or individual process that helps participants seek and reach goals? Usually there is one leader directing the activities and guiding the persons in finding their own inner strength to follow through on their dreams. Is it a group of colleagues who meet regularly to discuss common issues related to their professional lives, to share information and strategies, and to receive emotional support? Which one?
B or D?
Okay, so B is a protective circle around the professional relationship that separates what's appropriate and not appropriate between the practitioner and client. What does that sound like to you? What term? A protective circle.
I'm gonna say C.
Yep. Vincent, what
Yes.
term would you use for a protective circle around the professional relationship?
Mentor. My fault.
No, boundary.
Oh, boundary. My fault.
Boundary, a protective boundary. Okay, and then a group or individual process that helps participants set and reach goals. That's like a, I don't want to tell you wrong, but it's something like a business mentorship. And then a group of colleagues who meet regularly to discuss common issues related to professional lives, share information and strategies. I'm not sure what, and receive emotional support. Not sure what that is. A process meeting regularly with a person who's trained in the skills of supervision to discuss casework and other professional issues in a structured way is clinical supervision. This group of colleagues who meet for emotional support, that's a peer group. An individual or a process that helps participants reach goals and follow through on their dreams, that's coaching. Mentorship happens through coaching. Coaching happens through mentorship. Blank is a transgression that may or may not be experienced as harmful. Boundary crossing, a boundary, transgression, or autonomy. Which one?
Boundary.
Okay, is boundary a transgression?
Oh wait.
Or is
wait.
boundary a protective circle that prevents transgressions?
So transgression.
Boundary is a protective circle that prevents transgressions.
Boundary
So-
cross.
Boundary crossing, yes. What is the difference between boundary crossing and transgression?
Transgression sounds more harmful or something.
Yes, that's exactly right. That's exactly right. And now read the question for me, please.
It says transition that may not or may not. I mean, may or
Yes.
may not as harmful.
That's
Okay.
right. Yes. So you see why it cannot be transgression.
Yes.
Yes. And autonomy, what's autonomy mean? Anyone? Auto means self. So what does autonomy mean? If you're autonomous, you do things for yourself. You get to decide and act for yourself. It's your free will, your right to decide for yourself. When a therapist honestly represents all professional qualifications and affiliations, they provide appropriate, okay, first of all, professional qualification, that's like your license and where you went to school. That's your qualifications. An affiliation is maybe you belong to a professional group, like maybe you're a member of, I don't know, the American Massage Therapy Association. That's something you have to join, right? Are you providing appropriate credentials by openly displaying certifications and licensing? Are you creating trust so the client has no doubt? Are you assuring clients by displaying your knowledge and using medical terms they may not understand? Should avoid the question asked by diverting attention to another matter. So these last two are like toss outs.
A.
So it's A.
Yeah, it's A. Yeah. Yeah, okay. Okay, moving on. What is the meaning of the word? I'm just going to skip this, okay? Sensuality is the quality or state of being sensual. What is the meaning of the word mentoring? An obligation or willingness to accept responsibility to account for one's actions and consequences. What's that term defined as, Stephanie?
An obligation or willingness to accept responsibility. Um,
I want you to be what for your actions and the consequences?
accountable.
Yes. Mentoring, a professional relationship in which a more experienced practitioner shares information, skills, and insights with less experienced practitioners to provide encouragement and support. To withdraw support, especially in spite of duty, the improper use, handling, or treatment.
B.
B.
B, yes, very good. What is the meaning of the term? What is the meaning of the term body language? That is communication in which people reveal clues to unspoken intentions or feelings through physical behaviors such as posture, gestures, facial expressions, and eye movements. The reason I'm just like quickly going through questions like body language and sensuality is because I think that they're too obvious to dissect, and it's 9:52. If you guys don't feel that way, if you want to go through them and get into the nitty gritty, you just let me know. What is the meaning of the word intimacy? A close association with or detailed knowledge of or deep understanding of a person. What is the meaning of the word hyperarousal? A physiological and psychological state of being awake, reactive to stimuli, or ready for activity. It involves the brainstem, the autonomic nervous system, and the endocrine system.
Yeah.
A state, yes, it's very possible, but being awake, reactive to stimuli, ready for activity, does that sound automatically like hyper arousal? Or does it just sound like, alertness or arousal?
Well, then it's B.
A state of constant alertness to danger, constant alertness, experienced by survivors of trauma, also described as chronic state of fight or flight. Yeah. A what is a focused group setting where the individuals in the group create specific goals for their business or career and provide each other with support and inspiration for achieving those goals. Is that a mastermind group, peer group, mentorship, or online discussion forum?
Peer group.
Peer group.
Peer group is for emotional support. They share
And-
stories. Yeah. Mastermind group, I think. Yeah. Not a mentor. A mentor is one person who shares information with another person. Usually it's from older, more experienced to younger, less experienced. What is the meaning of the term insider trading? That is financial gains that the individual may make based on information about company stock not available to the public. A blank is a systemic method or approach to gathering information about a client's condition and symptoms. Systematic method, like an organized method or approach to gathering information about a client's condition. Assessment, yes, assessment. Psychological strategies of relating to the world that are developed unconsciously to protect people from shame, anxiety, or other emotionally painful experiences that they are unable to handle otherwise is known as burnout, defense mechanisms, mediation, or sublimation.
Defense mechanism.
Yes. What is the meaning of the word sexualization? It is to make an event, a procedure, a conversation, or an experience into something that is sexual or could be interpreted as sexual. What is the meaning of the term code of ethics? operating principles and behavioral guidelines that members of a profession are expected to uphold, having requisite or sufficient skill, knowledge, ability, or qualities, a code of conduct that provides guidelines to those who post content on the internet as either part of a business or as a private individual, a principle that practitioners always act in the best interest of the client.
A.
That's right. Operating principles and behavioral guidelines that members of a profession are expected to uphold. Refraining from the use of any mind-altering substance before or during a massage is considered to be conduct under which code of ethics? Client relationships, appropriate techniques, scope of practice, or professionalism?
Professional.
I would say so. Yeah, professionalism. To prevent infectious and communicable diseases, the simplest, most effective way to minimize risk is hand washing. The CDC has 4 steps for proper hand washing. What is the second step? So the first step is get your hands wet
Apply
and
soap.
Apply
And-
soap to hands.
apply soap. Yes, and always read all the options. Rinse hands using warm water, rub hands together for 20 seconds, apply soap, dry hands with a paper towel, apply soap. Let's look at the order. Oh, no, it's rub hands together for 20 seconds. Okay, good. So we have to get this really clear. So the first one is apply soap. I misled you. Don't laugh at the old man. The first one is,
I would never apply soap first.
yeah, I know, me either. The first one is apply soap to the hands. Number 2 is rub hands together for at least 20 seconds to work up a lather. Number 3 is rinse hands using warm water. Number 4 is dry hands with a paper towel. Yeah, so it's apply soap, rub hands together, rinse hands, dry hands.
Okay.
Yeah, all right. I agree. What is the meaning of the term learning styles? A labeling of signs and symptoms by a licensed medical professional, the identification of underlying cause, etiology, pathology, or nature of a set of signs and or symptoms, a person's preferred method to take in information. 3 most common are visual, auditory, and kinesthetic. A systematic method. Yeah, that one. What is the meaning of the term power differential? The role difference between a practitioner and a client in which the client is vulnerable and the practitioner has more power by virtue of training and experience. Sound good?
Yes.
What is the proper stance for giving a massage? Feet parallel to the table with weight on back foot. Body properly aligned with knees bent, shifting body weight with the flow of strokes.
Yeah.
Feet parallel to the table. Okay. Yeah. While acting in the massage or bodywork capacity, I will not tolerate any sexual advances from my client. This is in accordance with which code of ethic? Which code of ethic? The scope of practice, appropriate techniques, advertising claims, or client relationships?
Scope of practice.
Scope of practice is what your state says you're qualified to do, what you can and cannot do. For example, massage compared to diagnosing a disease.
So client relationship.
Client relationship. Yeah, client relationship. A lot of questions like that are really just process of elimination. What is required of a licensed massage therapist after the license is issued? Renew the state license and required insurance coverage every year. Obtain continuing education hours, no requirements, or both A and B.
A and B.
A and B.
Yeah, A and B. Continuing education hours and renew the license and required insurance every year. Just a second, please. What does subluxation mean? It basically means joint misalignment or bone misalignment. So spinal subluxation are vertebrae or ribs that are misaligned. The use of radiography, that's x-rays, to detect spinal subluxations and misalignment is within which scope of practice? Pediatric medicine, chiropractic, athletic training, or psychology?
Chiropractic.
Chiropractic, that's right. A summary or outline of standards to which the massage therapist agrees to conduct their massage practices with a declaration of acceptable, ethical, and general principles of professional behavior is the standards of practice, code of policies, code of ethics, or standard of regulations?
Code of ethics.
Code of ethics, yes, very good. Let's see, just look at the definitions for the rest of these. Do they have them? No. No, they don't. They don't have them there. I think we had them early on. Okay, I guess we're not gonna go through all of them. Yeah, okay, so standards of practice was defined earlier as, I always like to get the exact definitions. Standards of practice are statements that describe the underlying principle of a given field, the expectation of professional conduct, and the quality of care provided to clients, the standards of practice. And then the code of policies, you could just call that the policies. Standard of regulations, that would be like what the state says you have to live up to, right? That could be things like qualifications to get certified or licensed, and to get recertified or relicensed, renewed every year. Okay, great. So we got to do more sections like this each class.